the mysterious novel coronavirus that has started a global pandemic. It invades our body on so small a scale that it's invisible to the human eye. But even though we can't see it, what we do know about viruses can provide a way to defeat it.
So my name is Zach. I am 20 years old. I go to Stark State. I am a chemistry major there, and I'm planning on becoming a biochemist at Akron University in the coming year.
My name is Laura Williams. I am a medical social worker at Akron City Hospital.
Okay, my name is Sarah Ray. I'm 21. I'm a student at Kent State University, and I work at Target.
Okay, and coronavirus is?
Yeah,
Okay, what is it?
it's a virus.
What does that mean?
Like, people get sick.
Okay.
So COVID's personally affected me in a couple different ways. One of the things that I liked to do on a daily basis was go to the gym and work out. I can't do that right now since the gym's closed. I had to buy some other weights. One of the really big things it's done is I am a server for a restaurant, and I don't have any source of income during this. And I'd like to get back to work, make more money, have something to do in my spare time, but I'm kind of just stuck here hoping that there's some money given to me.
COVID-19 has affected me personally, not a whole bunch, sadly, because I don't really go out a bunch. So staying in wasn't too much of a difficult thing. Lack of shopping has been a little bit difficult. At work, it has impacted me greatly. But that's about all so far.
How is your life different since coronavirus? Like, what things have changed?
My family,
How so?
because I don't get to see as much people as usual.
Anything else?
No, and school,
School. How's school different?
because I don't really get to see as much as my friends. And I have a new teacher at home,
Who's your new teacher?
my mom.
How's that?
It's okay.
Well, when COVID started, it affected me by having to move back to Ohio because I was studying in New York City and working there. So that was the most major thing. And then I'm not allowed to see my significant other because his dad has pulmonary fibrosis, so his lungs are all scar tissue, so I haven't been able to see him for 2 months.
Because we're hearing all sorts of things about the impact of the coronavirus on not just the lungs, but we're hearing about the liver, we're hearing about the intestinal system. There's just sort of all many aspects. We're hearing symptoms like people losing their sense of taste and their sense of smell before it's confirmed that they have the coronavirus. So let us start, though, with the lungs, because it's essentially a respiratory illness as we know it. Can you talk to us about what the coronavirus does to the lungs that inevitably leads to people dying?
So I'm going to speak to you because I have been looking after critically ill patients at NYU Langone, and we do see their major challenge is getting oxygen into the body, which is the work of the lungs. And I believe the virus is impacting that in two different ways. Certainly, the virus in the body, when it's at a level where a patient becomes critically ill, the level is so high, it triggers an intense immune response. And that is very much focused in the lungs. And the lungs begin to be very inflamed, concentrating with all kinds of cytokines. Those are molecule messengers telling the immune system where to fight.
So life has changed as a college student quite drastically. Since I'm a chemistry major, I have a lot of labs. I have a lab in my bio class and a lab in my chemistry class right now, neither of which I can go to, which is a little bit different than some people who could easily do online lectures, but lab is one of our biggest components of actually understanding what we're doing for our major. So some teachers are just kind of throwing up a couple videos, trying to like watch a reaction, take some notes, all that, take a little quiz on it. Others are being a lot more strict, and without the motivation that I had of actually going to class, I just kind of feel like I don't really want to do this.
How has school changed?
Because I don't get to see my teacher and my friends.
And anything else?
And recess.
Yeah, but every day like recess. Do you like the difference in school, or would you rather be at school?
Be at school.
Why?
Because then I get to see my friends.
Online school, because of COVID, has been very hard. Like, a lot of my teachers, as every other teacher, aren't equipped to teach online, so it's kind of just been the bare minimum, and I feel like I'm not learning anything, and I feel like I deserve my money back, but then it just goes into, like, if I get my money back, then a teacher gets less money. So, like, I guess I'm just gonna suck it up and learn nothing for $5K.
So my initial thoughts were that, yeah, this is probably going to get kind of big. As a biochemist, I do kind of understand disease vectors and all that stuff a lot more than the average person. I didn't think the US would enact a quarantine. I really didn't think we would have had it in us to do this. I was wrong, but I haven't been alive long enough to see the US enact such national levels of concern and shutting down businesses and all that stuff. But I definitely knew it was going to be a problem, especially after watching how fast it spread in Wuhan.
My initial thoughts were that the media was blowing this up to be bigger than what it actually was at the time.
My initial thoughts when COVID was announced in the US is that we weren't going to take it seriously. And I was scared, and everyone I knew was basically like, you need to calm down. It's not that serious. It's not going to affect us. And I mean, I was in New York, so it was kind of where it started to affect everyone first. So hearing everyone from Ohio and like all my relatives say that just pissed me off. And now here we are.
It's hard to say. One part of me says, yes, it is very dangerous. But the other part of me says, my selfish side says, I'm 20. I'm in the age group that's least likely to be negatively impacted from this virus. I'll probably just get a mild to severe flu and be done with it. But there's other people out there, not just me, that are immunocompromised, older age groups, have other issues, just cannot get sick for one reason or another. So I try to do my part in making sure they don't get it, but personally, I don't really care.
My thoughts now, that it's a pretty big deal and it's affecting the world greatly, and that numbers don't lie, and it's pretty big.
Do you think people are being too serious about coronavirus, or do you think people are acting
Too serious.
Too serious? Why?
Because everybody's freaking out about toilet paper.
Why do you think people are freaking out about toilet paper?
I don't know.
My thoughts are that it's just frustrating that people aren't taking coronavirus seriously and they act like it doesn't affect people, but coming from New York, where like I literally have coworkers that like their family members have died, it's just really sad. So it's still scary to me.
So as a country, I think that we're kind of handling this poorly, especially with laxing regulations. I think as soon as the regulations are relaxed, there's going to be another wave. There is definitely going to be another wave that starts. It's going to kill a lot more people, a lot more infected, and we may have to go into round 2. It's going to prolong everything is my guess. I could be wrong, but that's my thoughts on it. As a state, we were one of the first to enact a full quarantine. I think we did pretty well. There's a lot more we could have done. We could have provided more PPE, which is another thing completely different that I don't really want to get into. Most people don't have the proper PPE. They don't have the proper supplies or amounts of the PPE that they need. And the only thing I really think the state could have done better is give those to the citizens and enact the restrictions faster.
As a state in Ohio, I feel we're handling it very well. I think our governor got a good jump on it, has everything laid out and mapped out so people can handle it instead of everything happening all at once. He's been able to break it down and make it manageable as a state. As far as a country, I don't really know how other states are handling this. so I can't really speak for that. But as a country, I think it's impacting people a great deal.
I think Ohio is handling COVID better than the United States as a whole, at least. I just feel like Ohio is taking more precautionary measures than the US. And just like hearing people from like Europe and Asia like talking about Ohio, they obviously respect us more than the rest of the United States right now, which is kind of funny.
So some of the major social changes I've noticed is a lot more people are distancing themselves from others. Some are definitely just going against the grain, being like, I don't really care about this, blah, 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 blah. There's a lot of waiting in lines nowadays, especially at supermarkets, or since I'm moving into a new place, I've been going to Lowe's quite a bit. There's long lines at the door. Glass shields in front of cashiers, wearing masks, plastic bags over card readers. People being more cognizant of what they're doing in their day-to-day lives to at least attempt to stop the spread of the disease.
Major social changes. It's funny you asked that because today, after work, I was driving through Montrose, and it was weird driving through all those big areas that are normally packed full of cars and shopping people and traffic, and the parking lots were like empty, except for the employees that were at the restaurant, like maybe 4 or 5 cars in restaurant parking lots. And the big shopping strips were just vacant and nothing was open. It was kind of weird.
I know everyone acts like it's been a major social change, but at least from like following people on social media, like most people aren't taking it that seriously, so they're still like consuming the same amount they always have, like going out to stores like they always have, hanging out with friends like they always have. So like there's social change by people not doing as much as they used to in general, but like on a personal basis, I feel like there's not that much social change, at least here.
So I don't think people are really taking it seriously. Even in older age groups, which are more likely to be harmed by the virus, they're really not taking it seriously. A lot of people are going out, living their day-to-day lives as close to as what they could have, going to stores for fun, doing all that stuff, not caring about the guidelines, trying to jump in front of lines or get too close to people or talk in front of people with their mouth open. There's a lot of things that people are doing wrong during this PPE, other different things. I'm personally, out in public, I take it fairly seriously, as best as that I can. But in private, with my family or my friends that are also in my age group, none of us really seem to take it that seriously. I believe at some point most people will get this at some point. And I don't know. I could take it more seriously if I had the proper protection. I could. If I had tons and tons of gloves, you need to change your gloves after everything you touch, basically. You can't touch your face, you can't touch your phone, you can't touch other goods, you can't touch other items, you can't touch other people. People aren't doing that. They're just wearing their gloves and thinking it's sanitizing everything. To really, truly be able to take it seriously, you need to have the proper supplies, and I don't have those.
Yes, I feel people are taking this serious because it's impacted so much of the world and each country and how it's kind of flooded in. And am I taking it seriously? I think I'm taking it more serious now than I did in the beginning, just because I've seen how it's grown and expanded and the damage and deaths and the effects it's had on multiple people.
I feel like people don't take anything seriously until it personally affects them. So no, I don't think people are taking it seriously because it hasn't impacted them that much or their family. I feel like I'm taking it moderately seriously, but I guess I'm here right now, so how serious can I be taking it? Yeah, but like I feel like I'm taking it more serious than a lot of friends I know. Like this is the first time I've been to someone's house in 2 months, and like I haven't visited any of my other friends or family since I got back from New York, so I literally haven't seen them in like 4 months. But even if we did take it seriously, all my family works, so we are still at a higher risk.
So I think this will last. Well, they recently stated that they're going to try to relax restrictions. With the relaxed restrictions, I think they'll try to put it in place within the next month. They'll try to open up as much as they can. I personally don't think that's long enough, especially since we're still kind of in the curve. We haven't totally flattened it yet. Healthcare and hospitals are still at peak capacities. Ventilator shortages, N95 mask shortages are still going on. It's not the time to do it. But they're afraid of losing too much money.
Yet another great question. I don't know. I was just talking about that at work today. We have no way to figure that out, nothing really to guide that, because there's no cure for it. There's no antibody. There's no treatment. There's nothing yet. I think it'll probably linger for a while, but I don't think it's going to go away for quite some time.
I would say it would end in a couple months.
I think it'll last until there's a vaccine or until the U.S. government is sick of paying people money.
I think there are definitely a lot of positives that are coming out of this, not in the fact of the virus, but people are seeing more into what's going on in government bodies, how they view essential and non-essential workers, social distancing. It's just generally a good idea to try to not be right next to people, try to not go as many places as you normally would. I don't know, there's a lot of good and a lot of bad that's come from it. The lives lost is a lot of the bad, those infected, those having to work through all of it. But there is definitely some good, and I hope there is change after this to help stop something like this from ever happening again, or put aid in place for if it does.
I do think there are positives to this situation.
Expand.
I think it's bringing families back together. I think we know it's helping the atmosphere, I want to say planet in general. It's helping. It's kind of bringing me back to when I was a kid, when we would be at home and we'd have family dinners. Things wouldn't be open past like 8 o'clock at night. Things weren't open on Sundays. It was just more of a hometown feel. And I think that's COVID's kind of forced us back to that way of life.
No, there are no positives to COVID-19, because as much as people want to say it's helping the environment, well, it's just going to go back to normal. No one's learned their lesson. Companies are just going to want to make money again. So, not really any positives.
So the precautions I've been taking is every time I go out to do something, which I have been going out to stores like Lowe's and Walmart and stuff to get groceries and other essentials for the house, I don't wear gloves and a mask because I don't have enough of them. I don't even have one pair. They're not in supply. I didn't have a stock of them. I sanitize my hands after every visit. I try not to touch my face while I'm in the store. That's a lot harder to do than you say it is. Most people, I probably touched my face during this. It's hard to do. But people I know, they're doing similar things. Some are taking it less seriously, some are taking it more. My parents have some gloves and masks that they're using. They don't have enough gloves and masks to replace them every time, but they're trying. Usually 1 pair per day.
The precautions I am taking while at work, obviously we always have to wear a mask. We work in a hospital. We're around sick patients all the time. So we're always having our personal protective gear on. At home, really nothing. I have my masks, but obviously I'm not wearing them at home. I don't have people over. I'm not going over to my friends' houses. I'm not going out and about, really doing anything fun unless I have to go to the grocery store or, get something that I have to have.
Precautions I take are just like I wear gloves when I pump my gas, I guess. I wear a mask at work. I wash my hands. I take my work clothes off and put them in a separate area. I'm not seeing any of my friends or family really, which is hard. But it's probably the biggest precaution that I'm taking is staying away from people.
Actually, I feel very blessed. I was just thinking today, again, on my way home, how blessed I am as well as both of my kids, because we have all been able to work and make an income during this pandemic. And a lot of people are really being affected by this financially and hurting everybody. So I'm feeling kind of grateful that I'm able to still work.
Being an essential employee during COVID makes it feel like it's not real and no one's taking it seriously, which is probably why I'm jaded about the whole thing. Mm-hmm. It's nice being able to work. It's just hard knowing that Target and other companies don't seem like they're taking it as seriously as they could be, and that it's just hard not feeling valued as a worker in general, and it's not any different during this time.
This whole situation and my employer is fabulous. My boss is great. We're really, a lot of us, we're short-staffed, so we're having to work more. We have a couple social workers who are out and they're not coming into work due to either fear of getting sick or they are sick. So we're having to do a lot more work just to cover for those people who aren't there.
In New York City, when I worked at the Target there, they were a lot more precautionary, especially from the start. And like they were super sweet about me taking time off. And then I transferred to the Target here, and it was cool at first, working like 40 hours a week, but then they hired more people and their like hours changed. So like now that they don't need me, they don't care about me.
Am I ever scared to go to work because of the COVID-19? I am not. I am fortunate that the unit I work on, we don't have any positive COVID-19 patients. We have a handful of patients that they are being tested to have it ruled out, or they've already been tested and the tests have come back negative. The hospital is trying to keep all the COVID positive patients on 2 designated units.
It scares me sometimes. I'm not that scared of getting COVID, but I'm scared of giving it to the people I care about. Mm-hmm. And especially since my parents work other places, I could give it to them and they could give it to their employees. So that's scary.
We've had, as I mentioned earlier, the hospital has COVID positive patients in specific units. And those units, when their employers come, or not their employers, but when their workers come to our floor to help out or cover, somebody else who's not able to be there, people treat them like they're the plague. They don't want them around them. They don't want them, in their office. But the hospital, it's a safe place to be, even though it doesn't really seem like it is, but the precautions are all in place, and if you follow the rules, you should be okay.
I feel like I've never been appropriately compensated for the work that I do, as most people feel. A $2 pay raise is more than a lot of people, but I feel like it should be more, or the government should intervene and give us something, since a lot of people are risking their lives. I know it doesn't seem like that by doing like a 9-to-5 at Target, but people rely on us. So I feel like we deserve more. In New York, it started the same as Ohio. Their reactions to COVID, like people didn't really take it seriously. They thought it was just the flu, but everything got shut down within a week in New York City. Like all the businesses, like everything got shut down within a week, so it was kind of scary. And then we didn't have limits on food at Target, so like literally everything was cleared. Like those horror pictures of like everything off the shelves, like that was the Target I worked at. It was scary because I worked at like the front desk, or not the front desk, like a cashier. So I literally had to interact with everyone, and everyone was like telling me what was happening with them. Like there were people from different countries like, yeah, we're like stuck here now till whenever we can get back. And it was, the most scary part actually was riding the trains when COVID started happening, because it would be so weird to see like kids and babies down there, but like it used to be packed all the time, but it was so empty. Yeah, so there was definitely a panic to get out of New York. Like even at my job, people were leaving like the week before me, and like they were like, you just need to leave, like you're gonna get stuck here. Like everyone that was under 30 that I worked with like went home to their parents outside of New York City. Like everyone I knew except my cousin left New York City, obviously, if they had the means to leave.
And do you feel like, since you're doing school at home now, do you feel like you are even doing school, or does it feel like a vacation?
A vacation.
Yeah. And so you'd rather be at school though?
Yeah.
Yeah. How has this affected you in your sports?
It changed because usually like every Monday I go after school, I do my practices at basketball and baseball. So I really miss them, and I hope I could get back to sports in a couple months.
And so have you been playing sports at all since?
A little.
A little?
I've been playing basketball outside every couple minutes.
Good. No. Anything else you want to say about coronavirus or anything?
It sucks.
Yeah, it sucks.
The spread of the coronavirus between the upper respiratory area, where the virus is most transmissible, and the lungs, where it is most dangerous, may be why COVID-19 is potentially more contagious than MERS and SARS, and also deadlier than the flu.